PRISM, also known as Integrated Care Team, is a team set up with multidisciplinary elements within it. So we've got specialist nurses now, community matrons, therapists, district nursing, and they're all pulled together in one base to help provide the right level of care to that patient within the home environment. We use what's known as a risk stratification tool. It's called the Devon tool. The idea is that each month they run this tool within the GP practice, and it gives us a list of those patients who have had frequent admissions to hospital or to A&E, and ideally it puts them on this list, and those at the top of the list are those that we know probably could do with some input to prevent further involvement with secondary care in that area. So what we do is we work together in a regular MDT each month. We discuss these patients at the top of the list, and each patient will be allocated to an individual who will receive that care in the home environment. And then we build communication within that team. There could be more than one member of the team that is involved with that patient at any given time. At the moment, most of the team work 7 days a week. The plan is that we will progress towards that with more of the disciplines involved to provide all that care over 7 days rather than the 5, which is the core time we're covering at the moment. One of the biggest benefits has been communication. Rather than if one of the members of staff had been out to see that patient, they've come back, they've then had to refer through or telephone a specialist, let's say. They don't have to do that. We're under one roof, we're having regular meetings.
It's a lot more proactive, you get things done very quickly, people are around you to ask questions, and you don't feel as isolated.
The other really helpful thing is that then we can go out together. Like, we do a lot of joint visits, and it makes my assessment fuller and gives a rounder picture of the whole person, and then it makes it easier to support them and to give them the services that are really going to improve their lives and make things easier for them and prevent them from going into hospital.
It also helps improve the skills within the wider team because they can sit and communicate and discuss patients with the specialist nurses that are in the team or the therapists, and that in itself can only benefit patients in the long run.
Well, importantly, the carer is the focus in this as well. So what they have to say is heard. Also, what the family has to say is heard.
For me, PRISM is important because it's not just the health professionals who are within the team, but they have recognised and embraced the fact that there are services outside of the health profession that would actually support. It's the holistic approach that I like.
The enthusiasm for this system is amazing. It shall work because we utterly and completely believe it's in the best interests of patients that they should be treated where they are most comfortable. I have recently had experience of a couple who have had a whole series of husband falls, 999, hospital. And this had gone on for several years. He also has prostate cancer, and he has lots of other things that are ongoing and long-term conditions. And the cycle was getting worse. It was approximately every 3 months that he was going to hospital. Last June he fell. Back to hospital he comes, but this time he was transferred to the community ward. Whilst he was there, he was thoroughly assessed. He was taken in an ambulance to his home so they could see what he needed at home, and a team was put in place. The major difference being when someone comes now, it's someone who has their medical history. Since he's been having the home help, he's literally been able to get to walking with a walker again. So for her it's peace of mind. It's not having to worry in the dark moments in the middle of the night whether or not you ought to ring 999 or if it will be crying wolf, which is what happens if you don't have a team. It's about the fact that the anxiety doesn't build up because she knows there are people there not just for her husband but for her as well. Since the fall in 2013, he's not been back to hospital because the care team anticipate what problems may come, or they can discuss what problems are starting to come, and they can nip them in the bud because they can always bring in another member of the team if another skill is required. That is the secret of PRISM, and it's wonderful and it works.